The purpose of this video is to instruct physical therapists and physical therapy assistants who work with patients with low back pain on how to use the repeated movement testing SmartPhrases developed by the Low Back Pain Special Interest Group. According to the most recent clinical practice guidelines from the Journal of Orthopedic and Sports Physical Therapy, repeated movements with centralization and directional preference have level A evidence to support their use with patients with acute and chronic low back pain. The goal of the SmartPhrases is to elevate best practice and standardize care. To pull up all the SmartPhrases developed by our special interest group, you can type in .repmovttest lumbar. 5 SmartPhrases will pull up in response to this prompt. In this video, we will focus on the easiest to use and most comprehensive of these, which is the radio long button. This SmartPhrase utilizes radio buttons so that you can select from the drop-down pick lists, making documentation quick and efficient. At the end of this video, we will describe when you may want to use variations on the SmartPhrase.
Hi, my name is Shri. I'm a physical therapist and I'm part of the Low Back Pain Special Interest Group. And this is
Pawan Kumar Chikatla. I'm also a part of a special interest group, Low Back.
We are doing this video with the goal of trying to explain how we can document the repeated movement testing part of objective testing of low back pain and related conditions using the SmartPhrase that we have developed and that's easily being able to be pulled from Epic. The first part is about establishing baselines, which could be symptomatic baselines and or mechanical baselines. The second part is about repeated movement testing and checking the effect of the testing. The third part is to go back and recheck those baselines that we had established to see if there's any change in the baselines. And that change is what is going to determine what treatment principle or what directional preference and such things that we are going to utilize. All right, Paul, can you explain where you have your symptoms?
I have pain in the low back and going under the thigh up to the calf.
All right. Do you have anything else other than pain?
I do also have a burning in the calf.
All right. So here we would document the symptom location and whether it's pain, numbness, tingling, burning, anything. And then we would document the side of the symptoms. Here it's the right lower extremity. Can you give me a number between 0 and 10 for this pain that you're having right now?
I rate about 6 out of 10.
All right. Can I have you sit here on the table? All right. Next comes posture observation. In this case, it is seated posture observation. It could also be standing posture observation or any other positions we want it to be in. Here, we are making an observation of seated posture. And what we see is we have a slouched lumbar spine, increased kyphotic posture of the thoracic spine, rounded shoulders, protruded neck, like 99 out of 100 patients that we usually see. So it is a default in the SmartPhrase, so it can save us time while we are typing. Now, next to the default, there is also a place where we can document if we see any other versions of posture, including lateral shifts and such. The next section in the SmartPhrase is response to correction of posture. So here we are going to do a posture correction for seated position. Pawan, we are going to sit more upright and there we go. And usually we give it a little bit of time, a minute or 2 or 5 minutes as needed in each case. And then we're going to ask for any change to their symptoms. Pawan, is there any change to symptoms?
I feel a little better with the burning in the calf, but still I feel the pain in the thigh.
Okay, so in the SmartPhrase, we're going to fill it as better, calf or right calf. And then moving on to the next part of the establishing baselines is checking range of motion of the lumbar spine in different directions. So we're going to do that in standing position. First, we're going to check movement loss for flexion in standing. Okay, have you forward bend as far as you can go. Is that all you can go?
Yes.
All right, go ahead and come back up. Can you tell me where all you had symptoms?
Still have pain in the calf, the thigh, and the back.
All right. Was there any change when you did the movement?
The pain increased when I was going down
Mm-hmm.
and the all the way end, but when I'm coming up, I felt the same.
Okay. So the way we would document movement loss in the SmartPhrase is for flexion, we would say moderate loss. And then under the symptoms column, we would say back and right leg. Or we can say back, right thigh, and leg. Now we're going to move on to checking extension in standing. The Pawan, can you place your hands behind your back, like so? And then can you bend backwards as far as you can go? Is that all you're able to go?
Yes.
All right, come on back up. So where were your symptoms when you did this?
Still I feel pain in the back, thigh, and the calf.
Okay. How did the symptoms change did the symptoms change while you were moving?
While moving, I'm feeling more pain. And even when I come back to the straight, I don't feel any change. It's still the same.
Okay. All right. So his lumbar extension, I would call it major loss. And then the symptom location was again back and the right thigh and down to the calf. So now we're going to check motion loss for the side glides right and left. So Pawan, can you stand with your feet about shoulder width apart, which you're doing, and without moving your shoulders very much, just move the midsection over to the right side as far as you can, then come back, and later we're going to check going to the left side as far as you can. Right?
Okay.
Can you move the midsection to the right side one time? All right. Come back to midline. Was that all you were able to go?
Yes.
All right. Where was the pain location?
Same location,
Okay.
back, thigh, and calf.
Okay. Any change during?
No.
Okay. All right. Now let's move the midsection over to the left side. As far as you can go.
That's it.
That's it? Okay. Come on back. Where was the pain location?
Same location,
Same location.
back, thigh, and calf.
Okay.
No change with the pain.
Okay. So, as we could see, when the midsection moved to the right side, which is essentially a left side glide, because we got to take the direction of the upper segment, the proximal segments. So there was a left side glide when the midsection came this way. There was, in my opinion, minimal loss of motion. Whereas when we did the opposite, when the midsection moved left and relatively the upper body moved to the right, which is the right side glide, there was a major loss in motion. So that's how I would mark it, as major loss of motion to right side glide, minimal loss of motion to the left side glide. And the symptoms stayed about the same in this case. So we established the baselines, like initially pain location, pain intensity, posture, and then effect of posture correction, and then range of motion and motion loss and the symptoms. So that was the baseline establishing part of the SmartPhrase. So now we're going to start the repeated movement testing, and we're going to choose repeated flexion in standing first, just because that follows the way it is done in the SmartPhrase. So Pawan, let us have you forward bend repeatedly, and you go as far forward as you can each time, and you come back. Now, for time purposes, we're going to do only one repetition of forward bend, but in real life scenarios, we're going to do several repetitions, as many as needed for to be able to make a good clinical judgment or based on patient's tolerance. So let's have you do one repetition of forward bend as far as you can.
Yep.
And then come back up. Let's say he has done several repetitions of the forward bends already. Pawan, where all do you have symptoms right now?
Right now I feel pain in the back, thigh, and the calf.
And the calf. Was there any change to your symptoms while you were doing this?
Yes. I feel like my pain is increased.
It was increased while you were doing it. Okay. How is the symptoms now after you're done with it?
I feel a bit worse.
Worse. Okay. Let's also quickly check range of motion. So let's have you do 1 repetition of forward bend as far as you can go. Okay, come back up. I think this is less than what we had at the baseline test. Now let's have you turn to face me and let's have you do 1 repetition of the backward bend as far as you can go.
Yeah.
Okay, come back. I think that's also less than our baseline that we established earlier. Can you turn to face this way and do 1 repetition of the side leg going this way and that way? As far as you can go. All right, come back. And can you go this way as far as you can? Okay.
That's it.
So what we're seeing is range of motion in all 4 directions tested was less than the initial baseline that we had set up. Secondly, from a symptomatic perspective, patient said pain increased or symptoms increased in all of the locations, including the calf, during, and it remained worse. So in the SmartPhrase, in the tabular column, next to repeated flexion and standing, we have symptomatic response and mechanical response. Under symptomatic response, we have 2 tabular columns where we can describe the location of symptoms, which in this case, low back all the way down to the calf, which is the most distal symptoms. And we are going to also mark increase in symptoms during movement. In the next tabular column, after, we are going to mark it as worse. So we want to know what happens during, and we want to know what happens after, whether it remained worse or remained better and such. So that's under symptomatic response. And then moving on to mechanical response to repeated flexion and standing, we're going to say decrease range of motion in all directions. So essentially, in this case, repeated flexion worsened or increased the symptoms during the movement, remained worse after the movement, and it also decreased the range of motion in all directions after the repeated flexion was done. So we are going to go back and test a different direction in this case. However, I want to make a point that if his symptoms had all been better, if he said my pain has decreased, it has centralized up to my thigh, it has decreased the intensity, and then it remained better after this test, and then we checked the range of motion, and range of motion is all better in all directions, then we can, with some level of certainty, conclude that repeated flexion might be the direction to go as a treatment. In which case, there may not be a need to continue to do repeated movement testing in other directions. We can if we want to double check and make sure. But if there's a time constraint or any other reasons, or if we are very certain, hey, this is working really well, I've done several repetitions and it's giving a favorable symptomatic and mechanical response, we can conclude the repeated movement testing at this stage. But in this video, we're going to say he is actually not doing better. It's not a favorable response, so we're going to check a different direction. So we're going to move on to repeated extension in standing. So Pawan, can you turn to face me, and then place your hands behind your back, and then do several repetitions of backward bending back as far as you can each time. All right, thank you. So for brevity of the video, we're going to say Pawan has done several repetitions of repeated extension of the lumbar spine in standing. We're going to ask him for symptomatic response and mechanical response. Pawan, while you were doing it, was there any change to your symptoms?
Yes.
There was a change. Okay, what was the change?
I feel the pain in the calf got worse.
It got worse.
Yes.
Now that you're done with it, is there any change?
Still feel worse.
Okay, so just like how we documented for repeated flexion and standing, here we are going to say there is an increase in symptoms in the back, actually more so in the calf in this case. There was an increase in symptoms in the calf during the test, and the symptomatic response after was also worse because it remained worse after he got done with repeated extension. Moving on to the mechanical response, we're going to check range of motion in all 4 directions. Pawan, can you do one forward bend as far as you can?
Yeah.
Come back up. Was that all you were able to go?
Yes.
Okay. Can you try one repetition of going backwards as far as you can go?
Yeah.
Okay. Come back. Can you turn this way and then try side glide once this way and once that way as far as you can go? All right. And then let's go that way as far as you can go.
Yeah.
Okay. Come back. So in our opinion for this video, we're going to say movement in all directions decreased. So symptomatic response for repeated lumbar extension and standing during was increased in the calf, and that was during movement, and then it remained worse after the movement, and the mechanical response is decreased range of motion in all directions compared to previous baseline. After doing repeated extension and standing, in this case, the symptomatic as well as mechanical response were unfavorable. So we will move on to testing another direction. However, it's just like what I said after repeated flexion and standing. In case we got a favorable response of centralization of symptoms, and which means the symptoms remained better after the testing, or the range of motion improved as compared to the previous baseline, then we can stop the repeated movement testing at this point. We don't have to go test the other directions if we choose not to. So the next direction in the SmartPhrase is repeated flexion in line, and that's what we're going to test right now. Pawan, can you lay on your back on the table? Keep your legs bent and your feet flat. Go ahead. Now, I want you to bring both your knees to your chest and use your hands to give it a good squeeze and then release. And we're going to do several repetitions of that. And each time you squeeze, make sure you breathe out at the same time. All right? Go ahead. Bring it to your chest as far as you can. Give it a good squeeze if you can. Breathe out as you do that, and then you can bring the legs back. For brevity of video, let's say he has done several repetitions of this action. Now, we're going to repeat the same questions that we repeated after repeated flexion and standing, as well as repeated extension and standing, about symptom response, whether it increased during or decreased or no change. And then we can document accordingly under the during section of the symptomatic response. And then we're going to ask him about how are the symptoms after he is done with this, whether it remained worse or remained better or no effect. And based on that, we're going to document accordingly under the after part of the symptomatic response. And then we would also check range of motion baselines once again to see whether there's any change in how far he can move in different directions. And based on that, we're going to document as increase in all directions or decrease in all directions, or whichever way it actually showed up. And those options are available in the SmartPhrase, or we can just free type under the mechanical response. Now we're going to quickly move on to repeated lumbar extension in line, which is essentially the press-ups. So Pawan, can I have you lay down face down? And can I have you place your hands like you're going to do a push-up, but don't do a full push-up. Go ahead and bend your back as far as you can bend right here. We're going to do several repetitions of this, going up as far as you can go each time.
Yeah.
Is that all you're able to go?
Yeah.
All right, go back down. Now let us say he has done several repetitions of this, and we're going to say that he's not able to go up much further. His pain increased during the action. His pain and other symptoms remained worse after he was done with several repetitions. And we check range of motion baselines, and the range of motion baselines are worse compared to the previous baseline. In which case, this is again not a favorable response. But if it was favorable, symptoms centralized, range of motion increased in all directions compared to previous baseline, then we can stop the test here and say extension is the direction to go in this case. But in this video, this is not a favorable response, so we're going to move on to checking repeated side glides in standing. Go as far as you can every time, and then come back. Now, let us say he has done several repetitions of this action. We're going to ask him for symptomatic and mechanical response. Pawan, was there any change to your symptoms after doing several repetitions of side glide and standing to the right?
I feel my calf is feeling slightly better.
Is it okay? Good. Any other changes during
No.
the action?
I'm back feeling the same.
Okay.
I feel less pain in the calf.
Less pain in the calf. And is it remaining less pain after you're done with those repetitions?
Yes.
Okay. All right. Let's quickly check range of motion baseline. Let's have you forward bend one time.
Yeah. That's how I can go.
Okay, come back up. That looks like he's going a little bit further than the last time we checked, which is again a favorable response. Can you turn and can you show us how far you can bend backwards? That looks better than the last time we checked baseline. Very good. Come back up. So that's a favorable response too. Now, facing this way, can I have you side glide this way as far as you can, and then one time this way also. Okay. As far as you can go. All right, that looks favorable too. It's more range of motion. Can I have you go this way as far as you can go? Okay, that looks favorable too. All right, one back. So after doing repeated side glides in standing to the right, which is what I'm doing right now, we have gotten favorable symptomatic and mechanical response. So under the during part of the symptomatic response data entry into the SmartPhrase, we would say decrease symptoms in the right calf during movement. And then under the after section of the symptomatic response, we're going to say better. So this is the first time we were able to document a favorable response. Decrease in the calf during the movement, and then better after the movement, because it remained better after we did repeated side glides. Moving on to the mechanical response section, we would say increases range of motion in all directions. So essentially, this is a favorable response in this example. So we are going to stop the repeated movement testing here. If we choose to, we could try going the other direction. Good chance it might provoke a unfavorable response, but it's up to us if we really want to do it. The patient is happy right now, so maybe it's a good idea to stop when the patient is happy and we have a clarity about the direction. So repeated side glides to the right is the direction of preference in this case. So way down in the SmartPhrase, where we have a section for treatment principle, we would choose lateral principle in this case. Had he responded favorably to flexion, it would be flexion principle. Had the response been favorable to extensions, it will be extension principle. But in this example, it's going to be lateral principle is what we're going to choose at the bottommost part of our SmartPhrase. Now, just before that section, we have a section for provisional classification. And in this case, it is a derangement syndrome, because we saw a lot of classic signs of derangement syndrome. If we want to choose that, if we want to input that, it's our choice. If we don't want to, we can just do the treatment principle, lateral principle in this case, as our direction of preference. Now, moving on to the next section of testing, we have a bunch of static tests that are built into our SmartPhrases. There's a long version of a SmartPhrase where it's actually built in. There's a short version of the SmartPhrase where it's not built in, but we can pull it in as and when needed as another SmartPhrase. With the static test, it's going to be the prone lying, prone up on elbows, and prone with lateral glide, and a few other variations. It also has the manual shift correction for lateral shift situations. But all of those things are free text responses. And then there's also a choice to click not tested. So if we include the static tests, the response typing is all free text, so there's not much explanation we might have to do within this video. So that's how we would do the SmartPhrase for repeated movement testing. And we hope this will help standardize our care and would elevate our quality of practice.